In this video, I'll show you how to finally get lasting relief from sciatica with these 3 easy and safe core exercises. These core exercises are designed to stabilize the lower back so you can prevent recurring sciatica leg pain and start living pain-free again. Recurring sciatica leg pain signals 2 key issues. First, a need for more strength and stability in your lower back and glutes, which these 3 core exercises specifically address. And secondly, it suggests the root cause of the sciatica hasn't been fully identified or corrected for lasting relief. This is a big problem, and in most cases, the main reason for the recurring sciatica leg pain. Watch this video until the end because I'll show you 3 core exercises to strengthen your lower back and prevent recurring sciatica. Plus, I'll reveal the top unknown cause of sciatica and how to fix it permanently without surgery. Hi, I'm Dr. Joshua Gelber. I'm a chiropractor in the Annex area of Toronto, Ontario, Canada. We focus on helping people overcome headaches, dizziness, vertigo, neck, shoulder, and back issues through specific chiropractic spinal correction techniques. Before I dive in, I need you to smash that subscribe button if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. Why are core exercises crucial for preventing recurring sciatica? Let's consider first the origin of the sciatic nerve. Now, the sciatic nerve is made up of the L4, L5, S1, S2, and S3 nerves. L for lumbar, S for sacral, that's your tailbone. But it's the L4, L5, and S1 nerves that give the most problems for sciatica sufferers, mainly because these nerves get irritated or compressed by issues in the lower back or sacrum area. I'll talk more about this later. If the lower back is weak, stiff, or not moving well, it can often irritate the L4, L5, and S1 nerves, causing sciatica leg pain. And that's where core stability exercises come in. By strengthening the muscles around your lower back and improving movement, these exercises help prevent the irritation of the L4, L5, and S1 nerves, effectively reducing the risk of a recurring sciatica leg pain. Now, 3 of the best exercises for stabilizing and strengthening the lower back and core region are the back or supine bridge, the modified side plank, and McGill's curl up. I'll demonstrate all 3 of these core exercises and give you all the necessary repetition sets and frequency recommendations that I would give to one of my patients. Feel free to follow along and replay this part of the video to make sure you're doing the exercises correctly. Doing each of these exercises with good form is more important than how many repetitions or sets you do, like with anything. After showing you the 3 core exercises, stay tuned and keep watching. I'll reveal one of the least known root causes of sciatica and how to permanently correct it without surgery. The first exercise to demonstrate, the back bridge or the supine bridge. I'm demonstrating on a table. Better to be on the floor, a yoga mat, a carpet, something firm and flat. The goal for this exercise is to engage your hamstrings and your glute muscles to take pressure off and add relief to the nerve and muscle zone for that sciatic nerve, right up here. Form is always important with each of the exercises I'll show you. You want to start with your heels, barefoot is fine. Your heels a comfortable distance from your buttock. I'm not going to give you a specific amount, you'll know and we'll talk through the best fit. You'll know and we'll talk through the best position. From here, arms can be flat on the ground and you're going to, with your glute muscles and your legs, lift off the ground. And you can hold this 2 to 3 seconds and come back down. What you might feel at first, like I sometimes do, is a bit of cramping or complaint from the hamstring muscle. That's okay. That means to move your feet further away, an inch or 2. Plant again and lift. Your goal is to feel the glute muscles in here engaging and coming back down. So lift, hold, and drop back down. You do not want to engage the muscles up in here. That's what you're trying to relax, to release. So again, it looks like this. Now again, I had hamstring complaints for the first two. They weren't awake yet this morning. Then we'll lift. You want to do probably 15 to 20 repetitions when you can. If in the beginning these muscles are tight, tired, or not prepared, you can start with 5. But the goal is always to keep your form steady. Lift the same way. If you start to feel your back muscles engage or something feels cranky here, come back down and reset. It should feel like everything below the belt line is engaging. Your head can be face up. I'm just looking at you. Breathing out as you elevate. Breathing in as you come back down. You can push through your heels, or you can have your feet flat to the ground. When you're finished your set, relax here, roll to the side to come up. And that's the back and supine bridge to, again, engage the glute muscles, the hamstring muscles, but not the lower back where that sciatic nerve output needs some relaxation and some relief. Second exercise is the modified side plank. For those of you with any shoulder tightness or strain, be cautious here that this area of your shoulder is comfortable. It might take some getting used to. If you have any shoulder issues, this may not be the best exercise for you, but if you're okay and clear here, it's a great one. This is going to activate the muscles on either side of the lumbar spine, where the sciatic nerve branches out, to engage them. A lot of those stabilizer muscles that we don't strengthen while we sit and work all day, they get tired and tight. We're going to wake them up. It's a great follow-up to the bridge to get that next zone. Same premise, flat surface, floor. Now, a usual side plank means people are out, supporting from their ankles, the side of their foot. We're not going that far. We're going to get your knees in line with your hips, in line with your shoulder. And from here, making sure your form is always focused on, the goal is to lift. And again, you want to find that position where your shoulder says, I'm okay. If you're too far back or too far forward, you'll feel pinching, and we don't want to focus on the shoulder. We want to focus on the sciatica area, that lumbar spine. And again, we're going up and sinking back down. 2 ways to do this. You can work to hold this for upwards of 30 seconds straight. Breathing as you go. Trying to bring your head in level with the rest of your body. And you can do those in increments. Maybe you're going to hold 10 seconds times 3. Maybe you'll hold 5 seconds times 6. You can also go up and down, but I don't recommend that one unless you're really struggling to start, as it's more strain on the shoulder to lift up and down. You'll obviously want to repeat on both sides. I will demonstrate from the back so you can see the alignment along me. "30 seconds at a time is your starting goal. If you get better at this and you want to push to 60 seconds, you can still break it down into intervals. 10 times 6, 20 times 3, 5 times 12. Find a way that works best for you, keeping that form in line. head to chest to hips to knees should all line up with those knees bent, making sure that your knees aren't ahead of you or too far behind you. And then the goal here, engaging the side muscles one at a time where the sciatic nerves branch out to wake up those muscles that get tight and tired and weakened from sitting at a desk all day. The third exercise is the McGill modified curl up. This one is meant to be basic and straightforward depending on your relative abdominal strength, and it's to engage the muscles in the front of the body and again work to take pressure and strain off the musculature in that lumbar spine. Like the planks work the side and the bridges work below, we are now working around the front. This will invoke an alternating of one leg flat and one knee bent. You can choose, and you want to engage both, irrelevant of which side the sciatic is on. You may find one leg up or down is more comfortable at first, but it should equal out. For visual purposes, I'll keep my right leg down. Hands will go under the small of your back, and you are just gently depressing your lumbar spine onto your hands. That's your support. Now this is going to be not much elevation. Your simple goal is as if there was a book being placed under your head. You're lifting. What you're trying to do is engage those abdominals, pressing the lower back into the table. This is an exaggeration, do not follow this lead. But you're coming up with a marginal difference under your head and your shoulders pushing into your hands and coming back down. Here's what you might feel. You might feel strain under your chin, back of your neck, if your head posture or neck strength isn't where it should be. Don't feel concerned about that. That will catch up. But this is one where with hands in position, your repetitions can be 2 seconds at a time. Always feeling and being sure that your lower back is comfortable through this. Depressing slightly, engaging in the front, the abdominal core, and back down. Breathing out, breathing in. If you feel like your head and neck are really uncomfortable at first, go up lower. You can even take it as far as one hand under your head to relax your head and neck while you really focus on depressing your lower back to the surface and engaging your abdominal muscles. Perform 15 with each side. If you're going to switch it up, this movement is quite small. It's not a big engaging sit-up. It's not even a 3/4 pull-up or curl-up. And what my hand's doing with my head to demonstrate is just to take the edge off the neck activity and let it be more relaxing for the abdominal focus. So again, that's number 3, the modified McGill curl-up. Now you're equipped with 3 essential core exercises that strengthen your lower back, provide stability, and pave the way for lasting relief. But what is this common yet little known cause of sciatica leg pain? It's misalignments of the spine, specifically misalignments in the lower back region, L4, L5, and the sacrum, that tailbone. L4, L5, and the sacrum. Spinal misalignments are also called vertebral subluxations. Spinal misalignments, they're caused by various factors such as poor posture, repetitive stressful movements, trauma, sports injuries, even emotional stress. Now, these misalignments disrupt the normal alignment of the vertebra, affecting nerve function and potentially causing symptoms like sciatica. When the spine goes into alignment issues like this, the nerve roots that form the sciatica, those misalignments can be subtle, but they can be tipped, twisted, and turned. And the nerve roots and spinal cord, again, specifically L4, L5, and the S1 area, that doesn't actually come off in you. They get irritated. Now, the sciatic nerve branches into a single thick nerve. So we get S1, S2, and S3 involved. Misalignments here, pelvic misalignments, lumbar misalignments will all irritate and affect the neurology. When we get disc involvement, this is L4, L5. When there is twisting, compression, damage, or degenerative change, this disc can ultimately irritate the nerve root, the spinal cord in behind. A specific disc bulge has that possibility, but it doesn't require a bulge or a full herniation to irritate the nerve. Like my thumb rubbing along the nerve fiber, it's ultra sensitive. It would not tolerate this for very long. That's where we get sciatica flare-ups and sciatic nerve irritation interference from various misalignment patterns. Chiropractors detect spinal misalignments through thorough examinations that may include physical assessments, orthopedic tests, neurological evaluations, computer scans, and often imaging studies like x-rays or MRIs. Full spine standing x-rays provide super valuable insights into the overall alignment and structure of the spine, aiding in the precise identification of these misalignments, the subluxations. Lower back and sacrum misalignments can directly impact the sciatic nerve, as already mentioned, leading to leg pain, tingling, or numbness symptoms. Now, the compression or irritation of the sciatic nerve due to these misalignments disrupts nerve signals and turns into this radiating pain down the leg as far down as the big toe. Now, misalignments are often missed or undetected in conventional medical exams because they may appear more subtle on standard diagnostic tests, but it also might depend on who's reading the imaging. No judgment, no criticism, but it's what the people are looking for. A radiologist is looking for specific damage, deterioration, and disruption on x-rays and MRIs because the focus is primarily on symptom management rather than addressing underlying structural issues. Chiropractors specialize in examining the spine for these subtle misalignments through their multiple assessments and hands-on techniques, which usually leads to a stronger identification of these alignment issues. Once identified, specific chiropractic adjustments are the primary method used to correct spinal misalignments. These gentle and precise movements, manipulations, they help restore proper alignment and movement to the vertebra, relieving pressure on the nerves and facilitating optimal nerve function. As I stated earlier, most often sciatica happens when the L4, 5, and S1 nerves are involved. And oftentimes, there are other subluxations or misalignments near the top of the neck, or even here, the thoracic lumbar junction, that can be adjusted at the same time. This way, a more whole body or whole spine approach tends to help get results faster, and more importantly, can lead to a more permanent solution by addressing the root cause of the sciatica, compared to simply masking symptoms with medication or temporary measures. Core stability exercises, specifically the three we've already gone over, play a crucial role in complementing spinal correction and chiropractic care. The lower back is often weak, stiff, and overworked when sciatica shows up. By strengthening the stronger muscles of the gluteus trio, stimulating the side of the musculature of the spine, and engaging deeper abdominal core muscles, core stability exercises, specifically the three we went through today, play a crucial role in complementing spinal corrective care. The lower back is often weak, stiff, and overworked when sciatica shows up. So by strengthening the stronger muscles of the gluteus trio, stimulating the side musculature of the lumbar spine, and engaging abdominal core muscles, the deeper strained tissue of the lumbar spine and lower back gets support and some disengagement, allowing relief in many cases. Now, I'm having trouble narrowing down a single story to share with you about sciatica resolution. There are a few that stand out, but what I'll share is this. In every case that's entered my office, a thorough analysis, including x-rays, gives a ton of insight into how we can help and if we can help. And in each successful case, whether it was more lumbar and sacrum adjustments that were needed, or was increased attention to the upper cervical spine, and in some pivotal cases where previous chiropractic care had stopped working, and even a minor lumbar surgery didn't change much, it was all about the junction. Now, Sean, this young man, he had been on his way to becoming a golf instructor, and he was hitting hundreds of balls at the driving range on a daily basis, hundreds. He was repetitively rotating his core and built up, misalignment and tension above his lower back. It only took a few adjustments to truly source this unique cause, but the results were stellar. Sciatic issues gone. So this is a unique case where a full spine approach really makes a difference. So when you're looking for a chiropractor, it's essential to seek someone who's thorough with their evaluation, including analysis of x-rays, competent in their techniques, and most importantly, leaves you feeling comfortable and reassured about goals and outcomes. After that, the proof should be in the pudding. Lasting resolution and results, they may take time in some cases, but observing consistent progress is key, as is regular testing, not guessing about the results. I hope you found these three core exercises useful. Tell me which one you found the most useful. Was it the back bridge, the supine bridge, or the curl up? I love that supine bridge. Leave a comment, please share your experience. If you found value in this video, be sure to like and share it. And remember to subscribe if you want to enjoy a more comfortable and active life with better posture, increased mobility, and free of chronic pain. The next video you should watch is this one, where I guide you through 3 sets of sciatica relief stretches tailored to the various pain levels and intensities. You'll get exercises that improve mobility, flexibility, and reduce tension on the sciatic nerve. Go watch this video right now.